Hey everyone, and welcome back to our channel. Today I want to talk about something that's been sitting in my own kitchen pantry for years, something I often sprinkle on my yogurt or blend into my smoothies without a second thought. I'm talking about these tiny, unassuming seeds, flax seeds. We hear so much about them being a superfood, a little powerhouse of nutrition. But have you ever stopped to wonder if there's more to the story? Could this simple seed, something so many of us see as purely healthy, actually have a hidden side, especially for those of us taking certain medications? It's a question that recently popped into my head, and I knew I had to dig deeper. So, let's explore this together. Is flaxseed truly the heart's best friend, or could it be interfering with your health in ways you haven't considered? Stick with me, because the answers might surprise you. First, let's celebrate why flax seeds have earned their superstar status. The big deal about flax seeds really comes down to three key components: omega-3 fatty acids, lignans, and fiber. Let's start with omega-3s. Flax seeds are one of the richest plant-based sources of an omega-3 called alpha-linolenic acid, or ALA. Our bodies can't make ALA on their own, so we have to get it from food. Now, why is this important for your heart? Well, according to the Cleveland Clinic, these healthy fats are linked to reducing inflammation, which is a major driver of chronic diseases, including heart disease. They can help lower blood pressure and may even play a role in preventing the hardening of arteries. Think of ALA as the peacekeeper for your circulatory system, helping to keep things calm and flowing smoothly. Next up are lignans. Flax seeds are packed with them, containing up to 800 times more lignans than other plant foods. The Mayo Clinic points out that lignans have both antioxidant and estrogen-like properties. These antioxidants help fight off cellular damage from free radicals, which is like giving your body's cells a protective shield. For heart health, this antioxidant power is crucial in protecting your blood vessels from damage. And finally, we can't forget about fiber, both soluble and insoluble. The soluble fiber in flax seeds can help lower LDL, that's the bad cholesterol. It works by binding with cholesterol and bile acids in your digestive system and carrying them out of the body before they can be absorbed. The Centers for Disease Control and Prevention, CDC, confirms that managing cholesterol is a key strategy for reducing heart disease risk. So, adding flaxseed to your diet is like hiring a tiny cleanup crew for your cholesterol. When you put it all together, the anti-inflammatory omega-3s, the antioxidant lignans, and the cholesterol-lowering fiber, it's easy to see why flax seeds are praised as a heart-healthy food. Multiple studies have shown that regular consumption can lead to modest but meaningful improvements in blood pressure and cholesterol profiles. For many people, incorporating ground flaxseed into their diet can be a simple, effective step towards a healthier heart. It's a natural, whole food approach to wellness that feels good and has the science to back it up. But, as we're about to find out, the story doesn't end there. So we've established that flax seeds are nutritional powerhouses. But what happens when these powerful little seeds meet the medications you might be taking? This is where things get a bit more complex, and it's a side of the story we don't hear about nearly enough. The very things that make flax seeds so good for us can also cause some tricky interactions. Let's go back to that fiber. The high fiber content in flax seeds, especially the soluble kind that forms a gel-like substance in your gut, can be a double-edged sword. According to Medline Plus, this gel can slow down the absorption of anything else in your digestive system at the same time. This includes oral medications. Imagine you take your thyroid medication or a dose of aspirin. If you take it along with a big spoonful of flaxseed, that fiber can essentially trap the medication, slowing its entry into your bloodstream. This means you might not be getting the full intended dose of your medicine, which can make it less effective. Over time, this could lead to your condition not being properly managed. Then there's the effect on blood sugar. Flaxseed can help lower blood sugar levels, which sounds like a great thing, and for many people it is. However, if you are already taking medication for diabetes, like insulin or metformin, adding flaxseed to the mix could cause your blood sugar to drop too low. This condition, known as hypoglycemia, can be dangerous, causing symptoms like dizziness, confusion, and even loss of consciousness. It's a classic case of too much of a good thing. Another significant concern involves blood clotting. The omega-3 fatty acids in flax seeds are known for their blood-thinning properties. As noted by the National Center for Complementary and Integrative Health, NCCIH, this can be beneficial for heart health. But if you're taking blood-thinning medications like warfarin, or even common over-the-counter drugs like aspirin or ibuprofen that have a similar effect, combining them with flaxseed could increase your risk of bleeding and bruising. It's like doubling down on the blood-thinning effect, which could be risky, especially if you have surgery scheduled or are prone to injury. Lastly, let's touch on those hormone-like lignans. Because they can mimic estrogen in the body, they could theoretically interfere with hormone-sensitive conditions or medications, like certain breast cancer treatments or hormone replacement therapy. While research in this area is still evolving, it's a potential interaction that warrants caution and a conversation with your doctor. These aren't scare tactics. This is about being a smart, informed consumer of both food and medicine. The reality is, what we eat can have a profound impact on how our medications work. It's a dynamic interplay inside our bodies that we need to respect. So, hearing all this, you might be feeling a little confused. Are flax seeds good or bad? Can you still enjoy their benefits without risking these interactions? The answer is a resounding yes, but it requires a smart and mindful approach. The goal isn't to eliminate flaxseed, but to integrate it safely into your routine. First and foremost, timing is everything. This is the simplest and most effective strategy. To avoid issues with medication absorption, the advice from experts, including pharmacists and sources like Medline Plus, is to create a time buffer. Don't take your flaxseed at the same time as your oral medications. A good rule of thumb is to take your medication either 1 hour before you consume flaxseed or at least 2 hours after. This gives your medication a head start to be absorbed properly without the flaxseed's fiber getting in the way. You could have your flaxseed in your breakfast smoothie and take your morning pills an hour before, or wait until a mid-morning snack. It's a small adjustment that can make a huge difference. Second, start low and go slow. If you're new to flaxseed, don't suddenly start adding half a cup to your daily diet. The recommended daily serving for most people is about 1 to 2 tablespoons of ground flaxseed. Starting with a smaller amount, say a teaspoon a day, allows your digestive system to adjust and lets you monitor how your body responds, especially in relation to your blood sugar or any other conditions you're managing. Gradually increasing the amount allows you to find the sweet spot that works for you without overdoing it. And remember, always drink plenty of water with flaxseed to help that fiber do its job without causing digestive upset. Now for the most crucial piece of advice, talk to your healthcare team. This is non-negotiable. Before you make flaxseed a regular part of your diet, especially if you're on any medication for chronic conditions like heart disease, diabetes, or a blood disorder, have a conversation with your doctor or pharmacist. They are your best resource. They know your health history. They understand the specific medications you're taking, and they can give you personalized advice. You can say something as simple as, "I'm thinking about adding flaxseed to my diet for its health benefits. I'm currently taking name of medication. Are there any interactions I should be aware of?" This proactive conversation empowers both you and your doctor to make the best decisions for your health. They might recommend more frequent blood sugar monitoring if you have diabetes, or a blood test to check your clotting time if you're on a blood thinner. Dr. Nika Goldberg, a cardiologist and medical director at NYU Women's Heart Program, often emphasizes the importance of this holistic view. In her work, she highlights that dietary supplements and even healthy foods are not a one-size-fits-all solution. She says, it's vital for patients to tell their doctor about everything they are taking, not just prescription drugs, but all supplements, herbs, and significant dietary changes like adding flaxseed. This transparency is the key to a safe and effective health plan. So the solution isn't to fear flaxseed, it's to be smart about it. Time your intake, start with a small amount, and most importantly, keep an open line of communication with your healthcare provider. By doing this, you can safely harness the incredible heart-healthy benefits of these tiny seeds without falling into the potential pitfalls. It's about being an active, informed participant in your own wellness journey. So what's our final takeaway on flax seeds? These tiny seeds are undeniably packed with heart-healthy nutrients that can offer real benefits, from lowering cholesterol, to reducing inflammation. But, as we've learned, they are not just an inert food. They are biologically active, and their potent effects on fiber, blood sugar, and blood clotting mean they demand our respect, especially for those of us managing health conditions with medication. The message here isn't to be afraid of flaxseed, it's to be educated. It's about shifting our mindset from seeing food and medicine as two separate worlds to understanding that they constantly interact within our bodies. Think of it like a dance. For the dance to be graceful and effective, both partners need to be in sync. Your diet is one partner, and your medication is the other. It's your job, with the guidance of your healthcare team, to be the choreographer. The power is in your hands. By simply timing when you eat your flaxseed, starting with a sensible portion, and having an open conversation with your doctor, you can turn a potential conflict into a powerful, heart-healthy partnership. You can enjoy that nutty goodness in your morning oatmeal or smoothie with confidence, knowing you're doing it in a way that's safe and smart for your unique body. Your health journey is personal, and being an informed, proactive participant is the most powerful thing you can do. Don't be afraid to ask questions. Don't hesitate to bring up your diet with your doctor. It's all part of the same picture. Thank you so much for joining me today to untangle this important topic. I hope this has given you the clarity and confidence to make the best choices for your health. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more deep dives into health and wellness. And I'd love to hear from you in the comments. Do you use flaxseed? Have you ever discussed it with your doctor? Let's continue the conversation. Stay healthy, stay curious, and I'll see you in the next video.